Well, welcome everybody. Good afternoon. Thank you for joining us on our quarterly symposium with the USC Institute for Integrative Health and Wellness. And my name is Jeffrey Gold, and I'm the director for the USC IIHW, which is located under the umbrella of the USC Office of Religious and Spiritual Life, or what we call ORSL. So thank you for joining us. Today's topic is what is sleep and why does it matter? You can see the EADS code there to get your continuing education, continuing medical education. If you have an EADS app on your phone, you can just plug in the code. If not, you can go and sign up for EADS and then use the code to get your credit. So our mission at the USC IIHW is to promote health and healing of individuals, families, and communities. We serve through the advancement of practice of integrative health, the science upon which it is based, and the education of healthcare practitioners and our USC community. Our vision is to transform healthcare by establishing a collaborative, holistic paradigm that promotes health and healing and integrates all aspects of human life: physical, emotional, mental, spiritual, cultural, social, and environmental. We like to acknowledge the land that we work upon and reside. The Institute of Integrative Health and Wellness at the University of Southern California and Children's Hospital acknowledges our presence on the traditional and ancestral and unceded territory of the Gabrielino and Tongva peoples, and we recognize that these peoples were forcibly removed from their homelands. We take this opportunity to acknowledge the generations that have gone before, as well as the present-day Gabrielino Tongva people. With humility, we recognize and respect all Indigenous peoples, their histories, their lives, and their land. And we recognize a number of these Indigenous tribes and the people for the land that USC occupies around Southern California, as well as Children's Hospital Los Angeles. We pay respects to their past and their present. Let this acknowledgement serve as an ongoing reminder of the original inhabitants where we and you reside. So again, thank you for joining us today. You can use this continuing medical education credit for EADS. I think that is a different activity code. So we'll make sure to post the proper activity code in the chat or the question and answer. So anytime you have any questions or answers that we'll be responding to in chat, that'll be the Q&A button below, not the chat button. So if you have questions that you want to post to the presenters, please put that in the Q&A. I want to acknowledge our steering committee, who are all listed here. We have an executive steering committee and staff, and I value and appreciate all of them for all the tireless work that they do to maintain our Institute of Integrative Health and Wellness, and of course, Dean Varun Soni, who's at ORSL. So our next and final quarterly symposium will be at the end of this year in December, looking at virtual reality in healthcare. So please look forward to receiving some of those messages through the listserv. If you haven't signed up for the listserv, please do so. And I will now pass along the microphone to Dr. Laura Baker, who will begin our symposium by introducing some of our presenters and initiating our symposium. So thank you so much for being here today, and look forward to the talks.
Great. Thank you so much, Jeffrey. And thank you, everyone, for being here. And thank you to our panelists for joining us for what I think is going to be a really interesting and very practical symposium. We all know that sleep is important. In some sense, we don't even need research to tell us that, because if we are lacking in a good quality and quantity of sleep, we feel terrible, both mentally and physically. I teach a couple of undergraduate courses here at USC, and I ask them every week, how did you sleep last night? And out of the 20 students, maybe there's one or two that say they slept for a good 8 hours. And a majority, or at least a large number, often say they sleep for 5 hours or less a night, and that's typical for them. And this takes its toll on them. So we were inspired by this and other observations of our own to put together this symposium on sleep. So we have brought together these 3 experts to talk about sleep. What is sleep? Why is it important? and what kinds of things can we do to optimize our sleep so that we can function at high levels. So we're going to begin with Dr. Emily Gillett. She's an attending physician of sleep medicine and pulmonology here at Children's Hospital. She's an assistant professor of clinical pediatrics in Keck School of Medicine. And Dr. Gillett is going to introduce the importance of sleep and the idea of sleep medicine. What is the field of sleep medicine? So let me turn it over to Dr. Gillett. We'll hear after Dr. Gillett from our two other speakers, and then we'll have plenty of time for Q&A. So thank you. It's all yours.
Great. So let me share my screen here. It's really a pleasure to join you guys today. I'm really excited to be part of this symposium because I think like holistic approaches to health and wellness are so critical and important. So what I wanted to discuss today is some aspects of sleep and sleep matters and kind of give you an introduction to sleep health and sleep medicine. So I have really no financial disclosures for this talk. I wanted to share with you at the beginning a few of the objectives that I posted for the talk, so you can kind of keep an eye out for these particular topics during the talk, because these are some of the things that I was hoping that you might take away from the discussion today. So one objective was that to help you understand some of the characteristics of healthy sleep, to be able to identify some examples of functional impairment that are linked to insufficient sleep, and one or more ways that healthy sleep kind of improves your daytime functioning and health, and to be able to identify some components of modern life that can impede our ability to build healthy sleep routines. So I wanted to start with one of the quotes that I really love that was first shared to me by my mentor, Sally Ward. And this is from our theoretical biologist named Arthur Taylor Winfrey. And one of the things that he said or wrote was that our whole economy and social structure is organized around the astonishing fact that we must slumber helplessly once in each rotation of the planet. And I really love this quote because I think it sort of conveys both kind of the wonder and strangeness of sleep, but also its sort of essential quality for each of us as individuals, but also the way that we've had to kind of develop our society and societal structure around the fact that we do have these essential periods of sleep that occur once in each cycle or rotation of the planet. So when we think about what is sleep, you know, there's many answers to this question, and it's something that we as scientists and physicians have been grappling to try to understand in great detail. But in general, you can think of sleep as an essential period of rest and restoration. And when you look at sleep throughout kind of life on Earth, it's evolutionarily conserved, which makes us all feel that this is really essential, not just for people, but for all sorts of organisms and life on the planet. And we all appreciate, as Laura said, that lack of sleep leads to daytime impairments in our ability to function and be healthy. When we say something is restorative, though, we don't want to confuse that with a passive process, because during sleep, there's really a lot that is happening in the brain and the body. So we're dreaming, we're building memories, we're clearing metabolic waste that's accumulated over the course of the daytime and our wake periods. And all of these kind of active processes that occur during our sleep are really important for functioning. So what exactly is happening during sleep? Well, there's a lot. So things appear quiet from the outside as we're sleeping, but when we look on the inside, there's a lot of active processes that are occurring. And I wanted to share with you this video that's based on some fMRI or functional MRI imaging from Laura Lewis's group at Boston University and Mass General Hospital. And so this is a video that I found posted on the NIH website. And what it shows you is some of the kind of blood flow and cerebral spinal fluid or CSF flow patterns that occur during normal healthy sleep. And the idea is that they sort of called this the rinse cycle of the brain that occurs when you're sleeping. So you get this blood flow through portions of the brain, and then the cerebral spinal fluid kind of washes things away. And this cycle kind of happens over and over. And this is one of the things that's happening as we sleep, and our brains are kind of resting, and things are kind of being restored after the course of a long day and period of wakefulness. So in sleep, there are two different types of sleep stages. You have REM or REM sleep, and you have non-REM sleep. And the two types of sleep are quite different from one another. And when you get a sleep study and you have the electrodes on your head, we can look at the brain waves and figure out what type of sleep you are in, how long you spend in each period, and how the periods are ordered over the course of the night for each individual when they come to a sleep lab or have their sleep characterized. So rapid eye movement sleep, it refers to these rapid eye movements where your eyes dart back and forth. And we can pick up rapid eye movements on a sleep study because we place like little electrode leads near the eyes. And your eye is actually a magnetic dipole, so that when it moves back and forth, it kind of triggers these differences in the electrical activity that's picked up by these electrodes. And you can see the eyes moving back and forth. And this movement of the eyes is very kind of unique to this period of sleep and distinguishes it from the other types of sleep that occur during the night. In rapid eye movement sleep, or REM sleep, you have often vivid emotional dreams. Most all of your skeletal muscles are paralyzed. So if you're dreaming about something exciting, you're dreaming that you're running or jumping, your body is not acting out the things that you're dreaming about. It's relaxed. And you have variable heart and respiratory rates that occur during this stage of sleep because your emotional dream content or the things that you're dreaming about can affect how quickly you're breathing and how fast your heart rate is. So we see a lot of variability. And in some ways, this stage of sleep is the most like being awake. During non-REM sleep, there's several stages. It's broken into three different segments, N1, N2, and N3. And each of these stages of non-REM sleep also has distinctive brainwave patterns or EEG patterns. But during this stage of sleep, things are more stable during N1, N2, and N3. Your control of breathing is more regular, and things are really driven more by metabolic factors like your oxygen level, your carbon dioxide level, and there's not that great variability that you see during the REM sleep when you have these really active dreaming states. Over the course of the night, you go through several what we call sleep cycles, and this graph is what we call a hypnogram. So it tells you over time during a period of sleep how you're progressing from one stage of sleep to another. So we always start out being awake, and then typically you would progress into N1, which is a lighter stage of sleep, into N2, and then into N3, which is deep or slow wave sleep. And N3 deep slow wave sleep is really important for the restorative function of sleep, and particularly important for children and adolescents who are still growing because there's production and release of growth hormone during this stage of sleep. So this is really important for a lot of things in the body. So you have this period, the longest period of N3 sleep is typically at the beginning of the night, and then you usually progress back to N2 and then into your first REM or REM sleep block. And sort of this pattern recurs at approximately 90-minute sort of cycles throughout the night. And you usually have 4 to 5 cycles during the night of progression through the different stages. Your rapid eye movement REM sleep blocks also tend to be shorter in the beginning of the night and then get progressively longer over the course of the cycles is a common pattern that we see. So when we get sleep stages in the sleep lab sleep studies, we like to see that the kind of architecture or pattern of the sleep is preserved, because when the pattern is broken, it can indicate that there's an underlying problem or underlying disease process that's impacting your kind of pattern and progression of sleep. So when we think about how much sleep we need, it really depends on the individual. So we know that based on kind of the stage of life that you're in, the amount of sleep that you require is different. So the humans who need the most sleep are newborns, and newborns might sleep anywhere from 14 to 17 out of the 24 hours of the day. And then as you get older and you progress through childhood and adolescence and into adulthood, the total amount of sleep that you require during the 24-hour decreases. But in adults, we still recommend to have at least about 7 hours of sleep and ideally 7 to 9 hours, but each individual might need more or less kind of within that range of sleep. So it's nice to ensure that you get enough sleep that you can wake up naturally without needing a lot of alarms and things to wake you in the morning. So if you wake up kind of spontaneously, that's a sign that you have gotten a good amount of sleep for your particular needs to function well and stay healthy. So one of the questions we might think about is, why do we sleep at night? So we have these day and night, light and dark cycles on Earth, and how does that connect to sleep? So it's all involved in and connected to our circadian rhythms. So when you look up the dictionary definition of circadian, It means being, having, characterized by, or occurring in approximately 24-hour periods or cycles as of a biological activity or function. So we all experience these circadian rhythms that are connected to the 24-hour cycle and 24-hour rotation of the Earth. Circadian clock components are conserved across species, so we think that they're really essential and really important. They were first identified in Drosophila melanogaster, which is the fruit fly, and actually the Nobel Prize in 2017 was awarded for the discovery of these factors in fruit flies that drive our circadian rhythms. But we also know that they're conserved in all sorts of organisms, from sunflowers to mice to humans. So it seems to be really important. Um, in terms of humans and the human brain and body, we know that circadian rhythms and patterns are set within the brain, but circadian clocks are also present throughout the human body. So light is a really important factor, sunlight especially, to sort of synchronize your clock and get you set on the proper wake and sleep sort of cycling. Light is sensed by special receptors at the back of the eye called melanopsin receptors, which aren't involved in vision, but they do perceive light and they help to synchronize the clocks inside the brain. And when you look deep in the brain, the central clock and pacemaker is located in the SCN, which is the suprachiasmatic nucleus. And this helps to kind of entrain that pattern and that 24-hour circadian rhythm in the person's brain in terms of their wake and their sleep. But it's also important to know that there are also peripheral clocks in the body that also have circadian rhythms. So we know that there are circadian changes that occur in the heart muscle cells, in blood vessels, in the gut, in the kidneys. So you can think that the master clock is located inside of the brain, but elsewhere throughout the body, all other organisms and cells have like little wristwatches, and they're also having these little kind of cycles of their own that are occurring throughout the day and the night. So when we think about the circadian patterns and kind of why we have wake and sleep and connected to light and dark and what causes sleepiness, when you look at sleep medicine literature, you're going to see described two different processes. Process C, which is the circadian rhythm up and downs on the 24-hour cycle, and also something that's called process S, which is the buildup of homeostatic sleep drive. And the concept of process S is that the longer you stay awake, there are factors that occur in the brain and the body that start to make you more drowsy and drive you towards sleep and the need for rest. So this is a graph of the circadian kind of pattern. This is a 2-day, 48-hour sort of representation. And you see that like the circadian factors are thought to go up in the daytime and down towards the evening, up and down, sort of like a sine wave. And then the beginning of the circadian pattern is sort of triggered by this light exposure and the sunlight, and then you're awake at the beginning of the cycle. And then the longer you spend awake, you have this buildup of these homeostatic sleep drive factors in process S. And as process S builds up and up and up and up, you get to the point where you're really tired and you really have to rest and you have to go to sleep. And one of the molecules that we think is important for process S is adenosine. And adenosine is like a metabolic factor in the brain. It's a nucleoside that may build up over time that you then need to get rid of. And adenosine binds to receptors in the brain that produce the feeling of drowsiness. And so when you hit this point at the top of the peak of process S, you then have to go to sleep and kind of rest and restore things. So another important molecule in our society is this one right here, which we pretty much all take in the form of tea or coffee. So this is caffeine, and caffeine blocks the effect of adenosine and reduces the level of drowsiness that we feel. So it kind of can help you stay more alert if you have built up adenosine to too high a level and you're feeling drowsy. So this is one of the mechanisms that caffeine exerts to help us stay more awake and alert when we're tired or sleepy. Another important molecule in this cycle is melatonin. So in the evening, as you're getting close to dusk and the sun is setting, you have what's called the DILMO or dim light melatonin onset. And so at the stage that the light starts to wane and you're getting more sleepy and tired, your brain starts to produce its own endogenous melatonin, which helps you transition into sleep. But one thing to keep in mind, and one thing that does get into a lot of our way in terms of our ability to sleep well, is light. So blue light from televisions, from tablets, from computers can suppress this DILMO or dim light melatonin onset and can make it more difficult for a lot of people to fall asleep in the evening when they would really like to be going to sleep. So there's a lot of technology can get in the way of this natural kind of sleep rhythms and sleep progression. So when we think about poor sleep and how you define poor sleep, as Laura mentioned, it can be related to quantity or to quality. So in terms of quantity, we want to be sure you're getting sufficient sleep, that you're getting that 7 to 9 hours that you need to feel good and function well in the daytime. And insufficient quantity of sleep can be kind of caused by many different things. A lot of times it's self-imposed restrictions. So you might be binge watching your favorite television show or on social media at night, but other factors, structural factors in your life can also affect your ability to sleep. Like you might have a shift work schedule where you have to work at second or third shift at night, and that can make it hard to sleep enough. For adolescents, especially, the school schedule and early wake times can be a challenge to get enough sleep. People might have parenting or family responsibilities. Parents of infants have to get up and they have very interrupted sleep at night. Or you might have insomnia that makes it difficult to fall asleep and you can't get those kind of recommended number of hours. You also can have degraded quality of sleep, interrupted sleep by many different things, but some of the common things that interrupt your sleep might be sleep apnea, restless leg. If you have chronic pain or discomfort that wakes you up, you might have some respiratory issues like coughing or shortness of breath. You might need to get up and use the bathroom and urinate overnight. So there's a lot of different things that can interrupt your sleep and make it less good quality. Degraded quality sleep makes you feel more tired and sleepy in the daytime. One of the most kind of important things to talk about when you're thinking about insufficient sleep is the risk of drowsy driving. So we know that any kind of sleep deprivation reduces your vigilance and delays your reaction time to things. And so drowsy driving is a really important kind of factor in terms of road safety and driving safety. The National Transportation Safety Administration estimated that in 2021, about 684 deaths occurred during that year from drowsy driving. And we think that drowsy driving contributes to about 100,000 crashes per year and about 70,000 injuries. Most of the crashes related to drowsy driving tend to occur during the midnight to 6 a.m. time frame when you normally would be sleeping. And your increased risk of having a problem if you're driving alone or if you're on a rural road or highway where things look really monotonous and you're more likely to kind of nod off and fall asleep at the wheel. And to kind of put it in context, they kind of make the level of impairment related to how long you're awake. They compare that to a blood alcohol level. So if you're awake for about 18 hours, that's more or less equivalent to blood alcohol level of about 0.05% in terms of the degree of functional impairment. If you're awake for a whole 24 hours, it's closer to 0.1%, which is far above the kind of legal limit in terms of what's safe for driving. So it's really important to think about sleep before you get behind the wheel of a car or take a trip, and to make sure that you ensure you have enough time to sleep before you have to drive. And then this is one of the safety signs and alerts that one of my colleagues took a photo of on her way to Utah. So it sort of recommends that drowsy drivers exit, and that discourages this fatigued driving, which we know is really unsafe for people. So we also know that sleep is really important for memory and cognition. And there's many, many, many thousands of studies that have looked at the relationship between sleep and memory. This is one of my favorite studies that I read about, and it was a group at MIT. Some professors gave their students, of about 100 students or so, Fitbits and actigraphy watches to track their fitness and sleep patterns. And they kind of looked at how things correlated with exam and performance in their course. And what they saw was that the folks who got more sleep and who slept on a more regular kind of pattern tended to do better on their exams and their performance in the course. And they found that people who had less sleep time or who stayed up past like 2 a.m. on a routine basis tended to do worse on their exams. So there definitely is a link to kind of good quality sleep and academic performance in the college setting. We also can dive deeper down and look at even molecular and cellular changes that are related to short sleep time. So we know that if you have chronic short sleep time, there's been studies that have shown that your cells age more quickly. So inside of our cells and the DNA, our DNA is broken into chromosomes. And at the end of the chromosomes, shown in this picture in pink, are what's called the telomeres. And these telomeres are repetitive sequences that protect all of the genes that are in the middle of the chromosome. And if you get chronically short sleep for long periods of time, these telomeres that protect the chromosome get shorter and shorter, which is a sign of cellular aging. So we know that the effects of sleep, we can feel them if we're not getting enough sleep, but even our tiny cells and chromosomes are experiencing changes related to short sleep time. And this is a second change that's been seen with short sleep, and that's in terms of our ability of our immune system to protect us from infection. So a couple of years ago, a group did a study where they looked at how likely you are to get sick when you're exposed to rhinovirus, which is a common cold virus, depending on how much sleep you've gotten during the prior week. So they tracked people's sleep for about a week, averaged their nightly amount of sleep, and then at the end of that week, they inoculated them with a little bit of rhinovirus into their nose, and they tracked them for the following 5 days or so and said, well, did you start to feel sick? Did you get a cold after we exposed you to rhinovirus? And what they saw was that if you got less than 5 hours of sleep on a routine basis, you were about 45% of the people did catch a cold, so almost half. But if you were getting more than 7 hours of sleep on average, then you were only about 18% of the people were getting the cold symptoms. So that's like 1 in 5 rather than 1 in 2. So we can have a big effect on your ability of your immune system to kind of protect you against insults and for your immune system to really be functioning at its best. So I think we all know that poor sleep really can have a myriad of different health effects, more than we could ever cover in one talk or in 1 hour even. But some of the things that you want to think about in terms of the health effects of sleep are that it does impact your cardiovascular system. It can affect your blood pressure. People with chronic sleep problems might have higher risk of heart attacks or stroke. It can affect your metabolic balance. It can kind of contribute to the pathway towards diabetes and lead to problems with impaired glucose control. It might make it more difficult to maintain a healthy weight if you don't also have healthy sleep patterns. People's mental health can be very significantly affected by poor sleep, with higher rates of anxiety or depression. And as we talked about with the exam and academic performance, neurocognitive function is really impacted by poor sleep, both in terms of our ability to remember things, but also long-term risks in terms of like increased risk of Alzheimer's disease and other kind of chronic disease states down the road. If you have chronic patterns of poor sleep, you may have higher risks of different
Dr.
diseases.
Gillett, we should wrap up pretty soon.
Yeah. So I hope I've convinced you today that sleep is really a pillar of health. It's important for safer driving, for focus and memory, for emotional regulation, and to lead a healthier life. Thank you.
Thank you so much, Dr. Gillett. And just a reminder, if you do have questions, to put them into the Q&A, and we will get to those after we get through all of our speakers. So let's just move directly on to our second speaker, which is Dr. Ravi Aysola. He is the director of the Sleep Diagnostic Center at UCLA. And he's going to give us an overview of sleep disorders and some of the research that's being done on sleep and sleep disorders. So thank you.
Thank you for that, Laura. I'm bringing up my screen now. And please confirm that you all can see it. I am Ravi Aysola. I'm a clinical professor of medicine at UCLA, just in town. And my objective here is to kind of discuss a little bit about sleep disorders after that excellent kind of setup by Dr. Gillett discussing kind of overall sleep. I have no financial disclosures or conflicts of interest to share. I'm going to discuss kind of the different categories of sleep disorders. And this slide is from what we have as our reference, the ICSD, or National Classification of Sleep Disorders, broadly categorizing the different sleep disorders as we approach them. A point here is these are not all in isolation. People can have more than one and overlapping and comorbid disorders at the same time. I show this because, as was just discussed initially, that we all kind of intuitively know the importance of sleep, but insist on continuing to study it to try to better understand and optimize sleep. One of these, this slide is showing what was recently hot off the press, presented on NPR as a study out of out of England, looking at a biodata bank of about 300,000 people, identifying habits and physical characteristics or behavioral characteristics that promoted health and were kind of protective against developing depression. The most impactful was healthy sleep, as you can see there. The blue bars farther left from that dotted center line show a protective effect or a decreased risk of developing depression if you participate in these activities, and healthy sleep is high on that list. Despite kind of our intuitive awareness of this and most of us, our individual experiences with sleep and the value of sleep, it wasn't really highlighted as far as a medical specialty or an area of medical attention for quite some time. It wasn't really until the development of EEG in the early 1920s and 30s that people started to look at brainwaves and then start to identify different patterns of brainwaves during sleep, recognizing it was not just a passive process, but a highly regulated process. I show this slide only to convey the fact that in 2017, the Nobel Prize for Physiology and Medicine went to a group of people, some from Brandeis University, who really identified the molecular mechanisms that control our circadian rhythms, or as was just discussed, our 24-hour clocks that are part of every cell in our body and help coordinate our body's regulation to our external environment. And this science was based on gene studies on fruit flies or Drosophila, again highlighting that these same mechanisms that developed evolutionarily in animals that we may consider as basic as fruit flies are still conserved into humans today. One kind of corollary study to this that I found quite interesting was one that looked at not just the timing or duration of sleep, but the actual time in the 24-hour day that sleep occurs, and took a bunch of healthy volunteers and forced and experimented with a forced desynchrony schedule, essentially making people sleep, eat, and be exposed to light off of their normal circadian rhythm schedule. And that kind of graphic immediately to the right of the text shows that the normal sleep schedule, where melatonin secretion increases and it's dark is when we typically sleep, people were kind of shifted off that typical schedule. And what we found when doing this, and we as scientists overall and clinicians, I wasn't personally involved in the study, but that sleeping the normal duration but at the wrong clock time or circadian time really disrupts gene transcription and regulation of a lot of what we would refer to as housekeeping activities within the body. And that a lot of gene transcription within the body is dependent on a circadian pattern, meaning it is linked to the 24-hour cycle that we are all exposed to. I'm going to focus a bit on sleep-related breathing disorders for a couple reasons. One, they're very common, very underdiagnosed, and I'm also a pulmonary physician, so it's an area that I focus on. I certainly see individuals with all sorts of sleep sleep disorders, but sleep-disordered breathing is one of the areas that I have particular interest in. Before we get to that, just to highlight what Dr. Gillett spoke about initially, kind of a very simplified, but I think a helpful way to think about brain states and sleep, as was described to me by one of my mentors, Dr. Friska Yango, a neurologist at UCLA for quite some time, who was one of the first clinicians here practicing sleep medicine. She would often say that when a person is awake, the brain is awake and the body is awake. When the person is in non-REM sleep, which includes, stage 1, which is a transitional stage, stage 2, and what we lump together now is slow wave sleep 3 and 4, the brain and the body are both asleep. It is a time during which the autonomic nervous system or the automatic nervous system tone is weighted heavily towards the parasympathetic, or what's often referred to as the rest and digest modality. And respiratory rate is relatively stable. Heart rate tends to slow down, and it's a pretty stable state overall in the absence of any pathology. In contrast, REM sleep is quite different in regards to the autonomic nervous system activity. There can be significant surges of sympathetic activity, the more fight or flight response, the response to emotional content of dreams, cerebral blood flow and glucose utilization can equal or exceed that of wakefulness. So a way we often think about it is the brain is awake, but the body is asleep, and profoundly asleep to the point where muscle tone is inhibited. And these will all come into play as we go through the next few slides. So how does this impact sleep, or how does sleep impact breathing overall, and how does this lead to any kind of dysfunction? First of all, there's a decrease in tidal volume, alveolar ventilation, PaO2, O2 consumption, and FRC. In typical words, that's we breathe more shallow, our oxygen levels drop, and we're not consuming as much oxygen as well. We're also less responsive, meaning the brain is less responsive to fluctuations in oxygen and carbon dioxide levels. Those aren't the primary determinants that control breathing when we're asleep. Additionally, because of the change in body position, the decrease in muscle tone, especially the upper airway resistance, meaning kind of in the back of the throat, base of the tongue, including the nose as well, increases because muscles relax. Because of the change in body position and the shallow breathing, our carbon dioxide levels in the blood can go up from normal levels. And as the graphic shows, when we sleep, and this is kind of showing it in the supine position, the area that can collapse is called the velo and oropharynx, which is the soft palate which hangs from the roof of the mouth and the base of the tongue, the uvula, can all kind of collapse and block the air passage, resulting in partial obstruction of airflow, which we call a hypopnea, or complete obstruction of airflow, which we call apnea. Depending on the frequency of these abnormal breathing events per hour, we come up with a characterization of severity of mild, moderate, or severe sleep apnea. And that index is called an apnea-hypopnea index, or AHI. Sleep-related breathing disorders, it's not just do you have sleep apnea or not, there's a spectrum of disease, but I think the key points I want to make here are that it is very common. 10 to 30% of the US population, that variability is in part related to the thresholds that you define as disease. About a third of people in the US with sleep apnea are not overweight. I'll repeat that. About a third of people in the US with sleep apnea are not overweight. And I say that because there is a general, I think, bias out in the community, and certainly it remains amongst several clinicians that you have to be a middle-aged, overweight, obese male to have sleep apnea. And that's really not true. We see it in all different types of body types. Certainly obesity is one of the biggest risk factors, but not only is a third of Americans with sleep apnea are not obese. That number increases if we look internationally. In women in particular, after menopause, risk of apnea increases significantly, and that's something that often can go unrecognized if people aren't being attentive. The vast majority of people with sleep apnea are undiagnosed, estimates of somewhere around 80 to 85%. Part of the reason for that is the symptoms that we attribute to sleep apnea, most commonly daytime sleepiness, does not correlate with severity of apnea. Said in another way, we have people who have very mild sleep apnea. Often it's younger patients, 20s and 30s, who complain a lot of disrupted sleep and daytime sleepiness. In contrast, I often see patients in their 60s, 70s, who are brought in by their spouse or partner saying that this individual sounds like they're choking every night. The individual will often say, I'm not sure why I'm here. I feel fine. I don't have a problem sleeping. So that the lack of symptoms correlating with severity often leads to under and undiagnosed individuals. The issue here, though, is in addition to symptoms, untreated sleep apnea can really increase the risk of other health problems, namely cardiovascular disease, high blood pressure, risk of heart attacks, heart arrhythmias or abnormal heart rhythms, heart failure, also increased risk of diabetes, stroke, as well as worsening of mood disorders. And that's specifically aggravated by sleep disordered breathing and sleep apnea, though sleep deprivation due to any cause can adversely affect immune function and mortality, as was just mentioned. Now, I put the spectrum of disease just so people have an idea. Not everyone who snores has sleep apnea. Most people who have sleep apnea snore, but not always audibly. It also depends on the size of the individual. There's different patterns apart from obstructive apnea. There's central sleep apnea, which is kind of a lack of coordination between the brain and the breathing muscles. And there's more complex apnea syndromes. We also see problems with oxygen and carbon dioxide and overall breathing in individuals who have restricted thoracic disorders, meaning that they have significant skeletal or musculoskeletal abnormalities that impair the ability of the thoracic cage to expand. Being very overweight contributes to that as well. And if there's individuals who have heart and lung disease, and what I often say to my trainees is if you have trouble breathing during the day, chances are you're going to have trouble breathing at night. May not be aware of it, but because of the physiologic changes that are associated with sleep and that impact on the cardiorespiratory system, existing disorders can be aggravated during sleep. As far as a clinical assessment, I won't read through this, but people can take a look. What I would really want to highlight is when we're talking to someone about whether or not they have sleep apnea, asking about snoring, asking about a bed partner's observations, morning headaches. There's some standardized scales that we use commonly in our reference, but I don't necessarily think are particularly definitive in identifying patients. The position a person sleeps in can often be a clue. Most people who have sleep apnea, even if they don't know it, will tell me that they cannot sleep on their back. They may not be able to say why, but they just know they can't. And often it's because they're not able to breathe effectively. Waking up frequently at night to urinate or nocturia is the most under-recognized symptom of sleep apnea. Those individuals who often are brought in by a spouse and deny any sleep-related complaints will admit to waking up 3 to 4 times, 5 times a night to urinate, and often after treatment that improves significantly. So I share this just to educate everyone in the audience that sometimes the typical symptoms that one may think of are not the ones that people experience. As far as exam, we're looking at the upper airway, the nose, the back of the throat, looking for jaw positioning and other factors which could narrow the air passage, which may predispose to collapse during sleep. Types of tests we do are in-lab sleep studies called a polysomnogram and home sleep studies. I won't go into too much detail there. I'm going to show some examples of what we see during a polysomnogram, which is an in-lab sleep study. Home sleep tests I'll leave at. The most home sleep tests that are used these days are only useful in confirming a diagnosis of sleep apnea, meaning if they're done on someone who we think has sleep apnea and it's positive, it's useful. It's really not useful for any other sleep evaluation, though oftentimes insurance kind of forces us to do that regardless of what we're trying to assess. Now,
Ravi, we have about 2 minutes, just so you know. Does that sound okay? 2 minutes?
Okay, I will go as fast as I
2 to
can.
3.
So this is a slide of someone having obstructive sleep apnea. I'll do my best to get through in the time I've got. I don't know if you can see my cursor, but what we're seeing here are eye leads. A person's eye movement is EEG brainwave. EMG is muscle activity. Airflow through the nose and mouth, which we detect by pressure and temperature, and oxygen levels. This is a 2-minute screen. A person is lying on their back. That's designated by this watermark. They're trying to breathe, but there is no airflow. So there's obstructive apnea. Oxygen levels are dropping from 96 down to 79%. This is the EEG. A person is going from a sleep brainwave pattern to an awake pattern. So they're waking up because of this. They fall back to sleep, pattern repeats itself, and this can happen 30, 40, 50 times an hour, every hour during sleep. It doesn't become a mystery how this contributes to cardiovascular disease. I will skip through this slide. Simply, this is a slide that's older, but I think I share with a lot of my medical trainees because it really identifies the mechanisms of how sleep apnea contributes to heart disease and heart dysfunction, both by direct effects on pressure, as well as effects on the nervous system and inflammation overall in the body. Studies that we've done at UCLA that I've been a part of, looking at the damage to the brain in individuals with sleep apnea using sophisticated MRI techniques. This is one called diffuse tensor imaging, which can assess the degree of damage, both acute and chronic, to certain brain areas by assessing how molecules move in and out of the brain. I'll simply put here that chronic sleep apnea, repetitive low oxygen levels, damages the brain, and it damages parts of the brain that are critical for control of kind of automatic functions, things like blood pressure and heart rhythm, as well as things more involved in cognitive functioning and mood as well. I show this slide again. This is a more condensed version. The risk of having apnea in any one individual relates to body position and sleep state. You're more likely to have apnea if you're on your back, and you're more likely to have apnea when you're in REM sleep. This person is on their back, they're transitioning, they're in non-REM sleep, but they're starting to have sleep apnea. This is a non-obese postmenopausal woman. The reason I make that point is that when she goes into REM sleep, the apnea becomes severe. This is a 2-minute screen, and for 81.7 seconds, this person is trying to breathe. These are efforts to breathe. There's no airflow. Oxygen level drops from 97% down to 62%. And this is happening every night while she's on her back during REM sleep. And most of the time, most people don't know it's happening. And this is a significant stress on the heart and the brain for you Shakespeare fans out there. Now, what do we do in these situations? This is one of my favorite slides, is a CPAP fairy coming in and putting the patient on CPAP. This is that same patient, same 5-minute condensed screen on CPAP, a setting of 7, and you can see that the R denotes that they're in REM sleep. The eyes are moving like crazy. Airflow and oxygenation are all stabilized, as has oxygen and oxygen saturation. Sleep apnea is extremely common, undiagnosed, and has a huge impact. In the interest of time, the key point I'd like to make here is this apnea-hypopnea index, is just how we define severity. Really is associated with long-term survival. When we get to a AHI, or apnea-hypopnea index, of 15 or higher, which is moderate sleep apnea or greater, people's long-term survival is impacted, as you can see in these survival curves. Treatment options, I share this because increasingly there are more and more options for treatment. It's not just CPAP. CPAP came out in 1981. It stands for continuous positive airway pressure. It's a medical grade air compressor that takes air from the room and blows it in the airways to prevent collapse. It is a very unsophisticated but highly effective treatment. It's gotten so much attention these days that even Homer's wearing his PAP device, which once you've made it on The Simpsons, you're legit and part of the culture. Didgeridoos are a way to strengthen pharyngeal muscles that may help in very mild cases. Problem is, no matter how strong those muscles are, once you're asleep, those muscles relax, so that can be problematic. And I will share in the last couple of slides that it's not easy. This is what I do day in, day out, to see patients with CPAP. And the key I find is educating people on why to use it and to work with them as they're getting along. Now, it can have a significant impact. This is taken straight from a blog. As I mentioned, though, that sleep disorders don't always exist in isolation, and there are issues with timing and circadian rhythm that play a role as well. Briefly touch upon sleep-related movement disorders, restless limb syndrome. This is another symptom that another disorder that can interfere with sleep without people being aware of it. This is a highly condensed version of a sleep study showing these individuals' legs kind of contracting with a periodicity. This can be associated with other disorders and contribute to sleep disruption. And then lastly, insomnia. Insomnia it essentially can be a symptom of every other sleep disorder as well, or multiple combining disorders, or not necessarily specifically related to sleep, but with the world and how we cope and manage with it. As we, this talk is an integrative medicine discussion, and as I hand off to Sara, I want to just mention that yoga and overall lifestyle can have a huge impact on overall health, and particularly in sleep. Unfortunately, it was not always respected, and I do think it's important as we acknowledge kind of the history and cultural issues that have impacted how we practice and medicine today, and those indigenous or kind of longstanding and ancient practices. I think it is important to note that my dad was born in colonial India, so it wasn't that long ago when calling yourself a yogi was a punishable offense, and it is something that I think those of us of South Asian descent and heritage still find important. And I'm almost done. My last takeaways are sleep disorders are common and often undiagnosed. They impact overall health, and they do not necessarily correlate with severity. Symptoms don't correlate with severity. Sleep and mood are intimately linked, and the best way for me to get you to sleep is to keep you awake. I say that to everyone who I see with insomnia. And the last thing I tell everyone with insomnia is you don't have to try and sleep. This last slide is the example of the Yoga Nidra Shakti Devi, who is all powerful and no one can deny, because that is sleep, and you will sleep eventually. Thank you for your time. Appreciate it.
Thank you so much, Ravi. That was a perfect segue into our third and final speaker. And I don't want to take up any more time except to just say welcome to Sara Ivanhoe. She is the director of yoga at USC. And she is also here to share with us hopefully some remedies that we could all take home. And she is also a PhD student and is going to share some of her doctoral research with us on sleep, I believe. So thank you so much, Sara.
Oh, thank you so much, everyone, for having me. Let me just try to share my screen here. Okay, can everyone see okay? Okay, I'll take that as a yes. I'd love for us to just take a mid-webinar pause for just a few mindful breaths. Allow your eyes to close. Deep breath in and out. Another breath in. Allow it to flow out. And last one, breath in and out. And allow your eyes to open. My presentation today, I'm calling In Search of Sleep, Contextualizing and Measuring Wellness Practices in USC's Undergraduate Population. And before I dive into the presentation, I want to bring your attention to simultaneously, I have curated some images for you. Sleep is sort of an ineffable experience, and it's not something that we can describe while it's happening because we're not conscious. We can observe it in others, we can anticipate it in the future, we can talk about it in the past, but because of this, it sort of allows us to be curious and contemplative with sleep. So I invite you to simultaneously see and be inspired by some of these images through history. To start by introducing myself just briefly, I think it's important to start off by sharing that I developed a very severe sleep disorder when I was very young, 4 or 5, 6 years old, something like this. My very first memories of being alive are lying awake all night. And throughout that journey, I've from a very early age sought to find practices that would support me in good sleep. And that will essentially be sharing with you what I have found will be the focus of my talk today. Also, I have no disclosures, and hopefully we'll have time for a little practice at the end. So I'll dive in. I'd love to start by defining what I mean by wellness practices for sleep. Wellness is sort of a ubiquitous term in the zeitgeist these days, which often refers to almost anything that seems to be, from nutrition to getting a spa treatment, etc. But in the context of my talk today, when I say wellness practices, I'm speaking about a combination of yoga, like stretching, breathing techniques, and also meditation techniques. And I think it's important for us to understand that these practices are not all relaxing. As I encounter them and tell people that I'm teaching yoga meditation for sleep, almost everyone seems to think that, oh yeah, well, all of yoga is relaxing, or all breath work is relaxing, all meditation relaxing. And it's actually not the case. It's quite interesting. Many of the practices that are the most common in our culture are actually quite energizing, and in fact, meant to be practiced at the moment the sun was rising, or meant to be sort of wake up type practices. So for instance, a Surya Namaskara, sun salutation, the arms sweep up. For anyone who's done this, the arms sweep down. The arms are meant to be mimicking the rays of the sun, embodying the sun, powerful energy. Virabhadrasana are the warrior postures that are meant to sort of get us ready to greet whatever is next. They're energizing, strengthening postures. Other standing postures in yoga are meant to strengthen the body, to help with agility and balance. Vrikshasana is a very common posture, the tree posture. So if anyone's ever fallen out of a tree posture, it's not relaxing, right? It's meant to bring us into balance and bring us into a heightened state of focus, which is beautiful. These are a few other balancing postures. And then in yoga, the practice of back bends are quite stimulating. They open up the airway. A couple of other interesting components with back bends. Recline twist, if you imagine sort of on your back and twisting. And then, of course, the headstand, sort of awakening posture. Same is actually true for breathing techniques, which it's been wonderful to see in the last, 5-10 years. Even breath work is starting to kind of get on trend. Perhaps the most popular breath work that's sort of in our world today, that's on social media a lot, is the Wim Hof technique, in which you immerse yourself in an ice bath and you do a breathing technique to keep your core body warm in order to withstand the ice. So of course that's a heating breath, that's an awakening breath. And his technique is, I'd say, most similar to what we'd call a Bhastrika or bellows breath, but also could be equated to the Kapalabhati skull shining breath, which is also called breath of fire. So energizing, strengthening breaths. All of these are, I'll just sort of skip through. So those are sort of some of the energizing techniques that we're very familiar with. But the postures that induce sleep are of a very different tone. Viparita Karani is essentially a supported, held, inverted posture, rather than something that focuses on balance that can kind of create stress. It's sort of a held and relaxing position. Anantasana, where you're on your back, you're on your side and stretching. Child's pose, many of us are familiar with. Supta Baddha Konasana, like a reclined goddess pose, if anyone's ever done that one. Very, very relaxing, restorative postures. Malasana is a squat. Dr. Aysola, I was so happy to see you use this wonderful image. This has been one of my favorite images for decades. This is Vishnu in Yoga Nidra. So just kind of moving on, the other postures in yoga that are beneficial for sleep, in my experience, are Janu Shirshasana, Paschimottanasana. These are forward bends in which the whole body sort of turns inward and creates not just physiologically, but almost an embodiment of a contemplative experience. Sarvangasana, shoulder stand, is as sort of in the yoga world, one of the best postures for sleep. And then, of course, for any of us who have taken a yoga class, the pose of Shavasana, the corpse pose, which is like a, reclined, you're lying on your back in reclined relaxation. Dr. Aysola also did a wonderful job of explaining with this breathing disorders and sleep apnea and the closing down of the throat. Interestingly enough, in the yoga practice, for anyone who has done a vinyasa yoga practice, we do a breathing technique called ujjayi, which is an intentional closing down of the throat, which creates a slowing of the breath, smoothing of the breath, and also sort of a hollow, relaxing sound that we can sort of identify with the experience of sleep. Chandra Vedana, the moon channel breath, is a nice, relaxing breathing technique. Kumbhaka means a breath retention, but for sleep, you would want to do your retention on the exhale. Like an inhale hold is, of course, wonderfully energizing for what everyone's about to do, but retention's on the exhale. Shitali is a cooling breath, as we mentioned earlier. The heating breaths are quite energizing, and the Sitali cooling breath is nice and sedating. And then one of my favorites is Brahmari, this bee breath, which is sort of like a humming. It's really fun. I also just want to point out that not all, even meditation is relaxing. A lot of people think that. In fact, there are some meditation traditions in which sleep is considered an obstacle, where they don't want you to fall asleep, they want you to stay awake and keep your mind focused. Really depends on what one's desired outcome is. So those traditions are incredible, and I have practiced them. For sleep, the Yoga Nidra, which is essentially it's got a very sort of complex history, but the way we practice it today is you're in a reclined position, one's eyes are closed, and we do sort of a little bit of a body scan. And keeping the mind focused on different parts of the body allows it, instead of drifting off into kind of a scattered place, it allows the body to, the mind to sort of stay with the body, and ultimately can be a way of supporting relaxation and sleep. Another is a counting breaths technique, which is sort of similar to what we might have been taught by our parents or grandparents if we were growing up, this practice of counting sheep, right? Why this sort of, one's mind is scattered, and this act of counting is a wonderful tool for sort of an anxious mind, focused mind. So counting breaths is one of my favorites. And then I've included here the practice of Trataka, which is a candle gazing. There's been some actually really interesting published material I was reading recently about, they did studies with flickering in the eye and relaxation response. In historical text, Trataka is actually considered, it's qualified as what we call a shatkarma, a cleansing technique. But in this day and age, Trataka, candle gazing, as a form of meditation, it's used within this meditation practice and can be quite effective for sleep. So you might be wondering, how did I come up with this list of energizing and relaxing practices? Very good question. The first one is what in my tradition we would call parampara, which sort of means lineage. It literally translates to the word, means uninterrupted. But the practice of yoga, breathwork, and meditation has a historical continuity for, it's all debated, but for a very long time. And even more than historical texts, these traditions were passed on in oral tradition from teacher to student, what we call guru to shishya, in a continuous lineage. And so there's so much about the practice that has been handed down that we don't have in texts. And my first sort of embarking on this inquiry was through reaching out to my teachers. When I was young, I would tell them I had trouble sleeping, and they would give me specific postures and breathing techniques in order to support my sleep. But as my journey continued, I became really interested in what was in historical text historical text. So this will be a huge part of my dissertation. These are the primary texts that I've been working with to develop this method, the Dattatraya Yoga Shastra, the oldest one, Hatha Yoga Pratipika, the Garanda Samhita, Shiva Samhita, Yoga Chudamani Upanishad. These all discuss these practices that I've just mentioned within different contexts and discuss different results. I've also I've been doing physical yoga now for almost 40 years and have lied awake many nights seeking to support myself with these practices. So I've had decades and decades of trying these things out. I began teaching yoga, meditation, and breathwork in 1995 and spent my first 3 to 5 years just sort of refining my ability to teach a class. But I very quickly really leaned into the focus of yoga, breathwork, meditation for sleep. So I've taught master classes and workshops, even sleep retreats, and have over the years received a lot of really interesting feedback from my students. What would work for me wouldn't work for them, and vice versa. So I've been really in dialogue with these practices. And then finally, as I'm sort of now well into my doctoral work, I've been doing a pretty thorough literature review to see what has been published of all of these practices in the scientific community. Just want to this is sort of a little bit of what it will all look like. For instance, the posture I mentioned, Viparita Karani, this is from the Garakshasharanam. This is how I sort of do my research. I go into here what Hatha Yoga Pratipika speaks about Shavasana. So I do sort of a thorough tracing of each of these practices. This Chandra Vedana one has been, for me personally, very effective. So these are the methods that have helped me to develop my intervention. And of course, the next step for me in this journey was to attempt to measure these outcomes. So I was invited by USC's Department of Physical Education, Mind Body Health, to develop a course for undergraduates, a 2-credit course called Sleep for Peak Performance. I worked to develop the course, got that approved through the curriculum board. And then I was lucky enough to be able to work with our Center for Integrative Health and Wellness and the Department of Physical Education, Mind Body Health, in a collaboration to measure the outcomes of the students going through the classes. So I worked to select sleep scale components of sleep scales in order to measure the outcomes. I developed a little bit of a sleep committee, so I had some input on choosing these, especially under the guidance of Tom Nyland of UCSF. So then we all worked together to get human subject protocol, and we began our pilot study in the spring of 2022. And here is a little bit, just our first round of outcomes. For our first round, we had 39 completes of the study. And what was actually quite interesting, and I don't know how to draw any conclusions on this, but we had much more women than men complete the study. But the biggest effect we saw was in sleep onset, in time it took to fall asleep. So we made some progress with that. Insomnia severity was decreased. Sleep quality was increased. I'm sort of running out of time here, so I'll just sort of keep going. But this research is ongoing. I want to really reiterate that was what we've done is just a pilot study. I do have 69 more completes from the subsequent semesters that I've taught. I've, I think, at least 30 people enrolled in the study this semester, so hopefully they will complete as well. But the next step, of course, is to continue this research and determine if these patterns were a one-off or if this is something that could be repeatable, generalizable. And then also potentially adding some sort of a control group to see, if this is validated. So I thought with my few remaining moments that I would lead us in a little bit of a practice. So go ahead and find yourself a comfortable seat. And then just start to roll your neck to the right. Roll the head and neck to the right a couple of times. Very, very gently. You might close your eyes. And roll it to the left a couple of times. Slowing down your breath. And then allow the head to come to a neutral position. A little bit of a shoulder rolls, hopefully. We've been sitting here for a while. This will feel nice. Shoulders up, back, and around. This is something that you can do pretty much anywhere. A nice way of sort of releasing tension throughout the day so that it doesn't build up for when you go to sleep. Okay, up, shoulders the other direction. And then allow them to release. And then just wherever you are in your chair, just twist over to the right for a moment. Take a deep breath. Twist over to the left for a moment. Another breath. And then come to a neutral position. Bring your awareness to the breath moving in and out through your nose. With your eyes closed, for just a few moments, intentionally try to smooth out your breathing. If there are little bumps or sticky spots in the breath, for a moment, intentionally smooth them out. Balancing inhale to exhale. So smooth that if I were sitting next to you, I wouldn't know if you are inhaling or exhaling or when that changed. And now allow the breath to come back to a natural pattern, even if that pattern is uneven. And as your breath finds its new rhythm, begin to notice that the breath actually moves the whole body. That as you inhale, the whole shape of your body rises up and expands. And as you exhale, the shape of your body softens and relaxes. And for our last few moments together, simply observe the rise and relax of your breath. Take one last deep breath. And when you're ready, you can allow your eyes to open. Thank you. I wanted to just give you a little bit of a taste of what we do in the class. These are my citations, and I just want to say thank you so much to the other presenters. I just learned so much today, and thank you so much for Center for Integrative Health and Wellness for hosting us. It takes a lot of work to put these webinars together. They may seem simple, but there were a lot of efforts, a lot of on the steering committee, a lot of time and energy put in today. So I don't take that for granted. And thank you so much for having me.
Thank you so much, Sarah, and also to Emily and Ravi for being here. And we do have now a few minutes for Q&A. You need to type your question into the Q&A function. And I just want to say that Dr. Aysola has to leave a hard stop at 1:25. So if there are any questions specifically for Dr. Aysola, we can address those first. And I don't know if you've had a chance to look through the questions. Dr. Aysola, is there anything there that you feel like you're the best person to answer? Because I do feel like we can probably address some of them with Dr. Gillett and Ivanhoe.
I appreciate that. I think Dr. Gillett will be able to answer any of the medical questions that I've seen so far. I don't think there'll be any issues with that. And I think Sarah, I know, will certainly be able to answer any of the yoga questions. The one thing I do see is the best sleep position. That depends on a number of factors. When it comes to breathing, the best position is, as far as apnea risk and obstructing the airway, is to not be on your back. Especially and not have your mouth open. The lower jaw is kind of a hinge joint, can slide back and obstruct the air passage. It's something that actually becomes clinically quite relevant. I see patients often who've done fine most of their lives sleeping on their side and then developed a orthopedic issue, hip, shoulder problems that then necessitated switching to supine sleep. And then all of a sudden they couldn't sleep anymore. So it really does impact the likelihood. And it can be really significant in some individuals. So if you are forced to sleep on your back for orthopedic reasons, elevating the torso can help, but it's really something that needs to be dug into with some detail because it can have a lot of impact on a number of factors.
Thank you. Thank you. I do notice a question about intermittent snoozing, which I could call napping. And that was a question I had too. Like, what is the value of napping? Is it a good thing to nap, or can it be disruptive? Does anyone, Ravi or Emily or Sarah, any of you?
I'll just share before I run that, as a pulmonary critical care doc, I did over a decade of ICU call where we had to do call nights and be awake overnight and deal with intense high risk situations. And I have 3 little kids at the time too, so I'm well aware of sleep deprivation and its impact on performance. What I had generally adopted to is when it comes to napping, we basically have kind of a dip in our natural circadian rhythm, as Dr. Gillett, I think, discussed, kind of in the early afternoon siesta time. So I generally say for people with a typical circadian pattern, you have 2 sleep opportunities: your nighttime main sleep opportunity and that siesta time where you make up for what you didn't get overnight or alter the duration depending on what you have to do afterwards. So in short, I think napping is ideal if you are not able to get the sleep you need at night. I think it's important that you limit the duration of the nap because you can develop, sleep inertia if you do it too long. And as I touched upon, it's not just how much you sleep, but when during your circadian phase you sleep as well. And I think that's critical.
Okay, thank you so much. Just kind of following up on that, I also know as a yoga practitioner and teacher that a lot of times I will find doing a restorative practice instead of a nap can actually help me to feel rested without making me feel sleepy. And I don't know if you want to add on to that, Sarah. You've kind of addressed that in talking about relaxing poses, but I don't know if you want to confirm that or say anything more.
Sure. I know that there is a sort of natural circadian dip in the afternoon, so it is natural to be tired during that time. There's nothing wrong with us. Like it does just kind of naturally happen. So I think just many people think, oh, what's wrong with me? I'm tired. It's natural to have a dip at that time. And yes, actually, for me, it's been my one of my main focuses. I find that doing a little bit of a practice, meditation practice, breathing practice, a little bit of restorative practice in the afternoon unfortunately, I'm not blessed with the ability to nap, so I've had to get really creative when I'm tired in the afternoon.
Right. Okay, thank you. And then, Dr. Gillett, there was a question that came up while you were speaking from Marissa, where she says, if a person only receives 4 hours of sleep and is waking up spontaneously and cannot go back to sleep, does that mean not enough time is spent in the N3 cycle of sleep, and therefore overall health can be affected?
Yeah, it's a really good question about kind of chronic short sleep times. It's interesting because we know that there are some families who have a genetic predisposition to shorter sleep times, like more in the range of 5 to 6.5 hours rather than the standard 7 to 8. I think it's hard to tell for an individual. 4 hours is on the shorter sort of side, even for those genetic conditions that we see in some families. So I think it is something that if someone were to experience chronic 4 hours of sleep per night, it's something they might want to kind of evaluate. I think you would only know about the sleep staging if you were to do the EEG evaluations in a lab, because that's the only way you can really know what specific stages of sleep you're personally in during the night. But it's an interesting question. And I think that, we do see changes in the stages of sleep a person enters if they're chronically sleep deprived. So if a person is chronically getting, 3 or 4 hours of sleep for several days in a row, when they do get those nights of full sleep, they may have rebound sleep, both rebound in their deep sleep and rebound in their REM sleep. So we do see alterations in your sleep architecture depending on the pattern of timing of sleep.
Great, thank you. And then there's also a question which I think is on a lot of people's mind about caffeine, which you did talk about, Dr. Gillett, but but there's kind of this question about how caffeine affects sleep. You addressed that to some extent, but what are the alternatives to boosting daily energy without sleep, especially in the midday? And we have heard from Sara, for example, and Ravi also, that well, not sleeping, but doing some restorative yoga and other relaxation techniques can be helpful. But does anyone want to comment any further on caffeine? When's the best time to drink it? Can everyone drink caffeine? I don't know if you want to jump in there, any of the speakers. Ravi, go for it. No, are you saying no?
I mean, I think, a lot of us have a chronic caffeine kind of dependence that we develop over time. And sometimes that's a compensation for chronic short sleep that a lot of us experience because of our work or family demands. I think things to keep in mind with caffeine are that if you also have insomnia, limiting your afternoon and evening caffeine intake can be really important. But it's also important to say caffeine isn't like a substitute for sleep. So you want to try to also look at your sleep and try to build in more sleep if you're finding yourself very dependent on caffeine. Its effects can wane over time. You may build up some, resistance, or like it may be less effective with time also. So you want to look at other aspects of supporting alertness and during the day.
Okay, great. There is a question about working out. Is working out before sleeping, does that impact the quality of sleep? Could be, yeah. Sara, go for it.
Yeah, actually, I just wanted to sort of just on what we had just talked about with caffeine, and then actually hopefully it'll be a natural transition. So I actually did an experiment on myself, and I went a year without any caffeine to see if it would improve my sleep at all. And it actually, being without the caffeine, did not have any effect on me personally. So, but what I would share that I think is absolutely imperative is that I would never consume any caffeine, and that includes even a chocolate dessert, after 12 noon. So just to give myself a really long padding, like what Dr. Gillett was saying, nothing in the afternoon, nothing remotely close to when I would sleep, because I just found lingering effects. So I do drink caffeine. I drink a lot of it, I drink it in the morning, and I allow it time to dissipate. But in regards to that morning fatigue, I've spent many a morning having not slept the whole night just because of my own insomnia challenges. And I do find that a very active practice in the morning is one of the best ways to shake off fatigue. So whether that's an active yoga practice, breath practice, I find just a walk in nature, sunlight exposure, just to get the blood moving is a wonderful way to sort of wake oneself up, even if we haven't had a good night's sleep. And then in regards to in addressing the exercise question, I think that there's a lot of contradicting points of view with that. I personally believe that if you are going to do a hard workout, I really like to do it in the morning so that there's no stress hormones released or whatever, that there's plenty of time to relax. But I have heard from many of my students that they actually really love doing a hard workout at the gym and then they collapse down. So I think it could be individual.
Yeah, and I also just want to add, I am aware that caffeine sensitivity can vary from person to person, and there can be a genetic basis to that. So there are some genes that make certain people more sensitive than others. And I know I'm one of those. From 23andMe, I got that analysis, and I know I cannot have caffeine after 12. But my son doesn't have that, and he can drink caffeine at bedtime, and it doesn't bother him. Go figure. So I think we're right up to the end of our time here. I want to just thank all of our speakers again. I hope that you all, like me, learned a lot. I learned a whole lot, and that you got some good suggestions for things that can help to improve your sleep. And then just a reminder again that we have our next quarterly symposium will be coming up in December. So if you're on our mailing list, you will get an email to register for that. So once again, let's just all thank our speakers and our organizers, Nat, for helping us to be here and running all the technical aspects. So thank you, and go take a nap.